All right, Tracy, I sent that over.
Okay, just waiting on it to come through.
Are we ready?
Not quite yet. Let me
Not
grab
yet.
this link and go get it posted.
Okay.
All right, let me just go verify that it's working. Advisory. Okay, you're good to go.
Okay, so meeting of the Medical Psychology Advisory Committee is called to order. Everybody want to identify themselves? Warren Lowe.
Rob Dames.
Kenneth Rochelle.
Darla Burnett.
Okay, thank you. We have a quorum. Do we have any public comments yet, Van?
None at this time, sir.
Okay, so the only item on the agenda today, there were a couple of others, but they didn't make it in on time. And they were really just discussion points, points of information, and probably didn't even need to be on there. But the important one is the restructuring of the MP licenses. Do you want to talk about that, Dr. Van?
Well, one of the things we wanted to be sure we do is if we make any changes, and I think the one thing we have to pull out is the issue of the psychometrician reporting. We don't collect it. We've never collected it. We need to get it out the law.
Yes.
And I'll let you talk about the other one.
About the restructuring of the license?
Yeah.
Okay.
Well, basically what I want to do is we're actually making you paying for two different things at the same time when I don't think you need it. Okay. Patricia and I have talked about it. We want to present it to the board and make sure that y'all are agreeing with it. Basically, what we want to do is instead of charging you for a MP license and then an advanced certificate, is basically change it to MP and then MP advanced, and it's just an MP advanced license, and you only pay for the license, and you don't pay for a certificate and a license.
So you're only paying for one license. You're either paying for the MP license or you're paying for the MP advanced practice license.
Correct.
I think that makes perfect sense.
When Van and I talked about it and he presented it to me, I could not think of a single reason why anybody would object to that. But if you can, maybe now's the time to address it. I mean, it makes perfect sense to me.
I think Helena Moreno wanted to make a request that the extra money be, converted to New Orleans budget.
Well, we are not going to basically we are going to charge a little more for the MP advanced, but less than the combination of the MP and the advanced, and we will have a slight decrease in revenue overall. But I think it's fairer to you all.
Right now, we pay more to renew our license than physicians do. Is that right?
That's correct.
So do we need to make a motion for that change? Or do we need to go over the wording, or is there something specific we need to address before?
Well, I would just like, if you all agree with it, I will present it to the board at its February meeting because we have canceled the January meeting because of the weather.
Then I'm for it. I'm for the change.
Well, let's make a motion. Is there any other discussion about it? Darla, do you have anything?
I do want to discuss for just a second. I have no problem with this change at all. I just want to think about the practicality of how we report things to other places that need to know our licensure status. So right now we have an MP license number and we have another number that becomes our certificate number for advanced practice.
Right.
Moving forward, we're not going to have two numbers. We're just going to have the MP license number and that's it? Or
No, you're going to have an MP license number, or you're going to have an MP advanced practice license number.
Okay. So you'll get a new number, or will they just add something onto your number so you know it's advanced practice?
Well, we're gonna structure that to work out so that it's clear and distinct and how it's gonna happen. We haven't sat down with the developers in the computer system, but my gut feeling would be it would be a new number that would be only for advanced practice. That way there's no confusion or anything else.
The only downside I could see to a new number at some point in your practice is like, because when you get on panels or if you're on, hospital, I'm going blank on the word I'm trying to use here, faculty or whatever, they need all that information. So if you're like in the middle of a year and this changes, like that would be the only, I just wanted to think that process through to make sure we're not putting up any roadblocks down the road we're not thinking of up front.
Well, again, what we would be doing is we would be putting it on our website before it happens. We would set a date when it's going to effectively occur. Everybody will be noticed. And then anybody who needs to notice a hospital or insurance company can do that. I think the key here is that A, we got to plan it. B, it's got to be done. And, we got to make sure that the developers get it done right so there's no confusion down the road, so that the computer program clearly reflects what's going on. We have a unifying, I guess for lack of a better term, an internal control number that each one of you has, we all have, quite frankly. And if I were to go tomorrow and get a license to be a clinical laboratory technician, I would have that linked to that very same number. So historically, we would know exactly when it changed from a MP with certificate to MP advanced license. All of that will be tracked clearly. So any question about it will be easily available publicly.
And it would be, I think, just thinking out loud, it would, since whatever's already been done for everybody's current status, it would be on the next renewal, I would think, right?
Yes.
Because, so you would have advanced planning involved with that as in terms of being able to make that change, kind of like you have to update your credit card when the expiration date changes or whatever. It would just update that at your renewal and you would get the new number.
I think it would make CE reporting easier too, because in CE broker, we have two ways, we have two licenses. And people
That's what
always
I'm
get
trying. I
confused
just
about
think it
which
makes
one to
sense for you
report.
all.
Yeah.
I never, until I started reading the law very carefully, I never realized that was being done, and I apologize that I didn't pick it up until recently, but we want to make it work for y'all.
I think it's a great idea.
Mhm.
I don't think anybody, I mean, that was the only thing that I mentioned, was the only thing I think people would be worried about. So if we have a way for them to manage that, then I think we're fine.
Yeah, I think it's awesome.
Well, I make a motion that we make this recommendation through Dr. Van to the board.
That we convert from an MP license and an MP-AP certificate to either an MP license or an advanced practice license.
Correct.
Do we have a second?
Second.
All in favor?
Aye.
Good deal. So, Van, this will be presented to the board in February.
Yeah, I'll put it on the February agenda.
And also the elimination of that reporting requirement for technicians will be presented to the board at that time.
Yes, yes. And then what I'd like, if you could, Warren, is we're going to have a bunch of other bills that we're working closely with the fourth floor with. But in order to, how do I want to say, have a different appearance so that you all don't get caught up in any crossfire that we may experience on other issues, I'd like you to ask Bud to give me a call. We'll talk about what the bill has to say. We'll help him draft it, but let's let Bud carry it independently. And we're just, as long as there are no changes other than we talked about, we're going to not oppose it or anything like that. And I think if there's any crossfire, you can dodge it.
Yeah, good. I mentioned to Bud that this was kind of being discussed. I didn't tell him how far it had gone, and yeah, he's on board with it. I mean, he'll carry the water.
Look, I know Bud's son works closely with the fourth floor, but we've been burned a couple of times, and I don't want this to get caught in the crossfire.
Okay, good. Do
Well, I
we
look forward
need,
to hearing from Bud.
do we need a section in our statute, in our law practice act about telehealth?
I would say the best place to put it, because the law is already written for all forms of providers, is in the rules, is to update the rules for telehealth. Now, because under the law right now, any of you all can do telehealth in Louisiana without a problem. A MP that wants to get licensed in Louisiana from out of state to do telehealth would have to go through the licensing process to do it, because there is no MP compact. If you wanted to do telehealth in Mississippi, Arkansas, Alabama, or Montana, you have to get the license from those states, not from us. So in terms of doing telehealth right now, you are permitted to do so. We have no rules at this time, but the law for telehealth has already been changed to allow you to do it. It's not specifically written into any healthcare provider law. It was written into a kind of an omnibus bill 2 or 3 years ago. And Patricia, correct me if I'm wrong, Freddie Mills put this in and he restructured it so that anybody can do telehealth, and we could write the rules to make it work if we wanted to.
I think
right.
that was in 2023 that he passed that bill.
Yeah.
So Van, let me ask you, we have been telling our members, since we don't have a general rule about telehealth, to follow the physician's rule as best as they can and incorporate those requirements into telehealth. So some questions have come up. We've been telling people that the provider can be located anywhere, but the patient has to be located in Louisiana, with the exception that if they're temporarily located out of state for school or a work assignment, it could continue under those circumstances.
Yeah, I think the key is if you're in your vacation home in Montana and you want to take care of a Louisiana patient, you are practicing medicine in Louisiana, which you are licensed, I should say medical psychology in Louisiana, which you are licensed to do. So it's not a problem. It's when the reverse occurs that you're in New Orleans and your patient is not a voter registered permanent resident of Louisiana, but in fact a permanent resident of Montana, and you're treating them, that Montana wants you to have a license. It's not us that requires it, it's Montana.
And that was my question. Suppose you are treating a student out of state who is a resident of Louisiana, but attending the University of Washington. Or should the provider get permission from that state to do that?
Well, it is unfortunately never been, how do I want to say, clearly defined, because every state kind of does it differently. But it's just like in terms of, Rob and I would understand this clearer, and maybe we can help you understand. I may be in New Orleans and my patient's vacationing in Florida, and they call me up and they say, I have a yeast infection from hanging around in my wet bathing suit. Dr. Carter, what can I do to help? I said, I'll send you some medicine. I pick up the phone, I call the Florida drugstore that she tells to call. I give them the prescription, I tell them it's my patient who's vacationing. That kind of stuff has just been, how do I want to say, assumed and not a problem. Telehealth has, because some states have different requirements about telehealth, the issue is you have to follow the state where the position, most everybody uses the concept of where the patient permanently resides, okay, not where the patient physically is. So I think that if I can't tell you what Mississippi's telehealth law is going to say. I can't tell you what Texas or Arkansas, that's not my area of expertise, and I wouldn't want to. But I can tell you that if your patient is permanent resident of Louisiana, but away at school in Montana, we got no problem here. Okay.
Right.
And Montana probably won't either. But again, I can't ever understand why Montana would, but every state is a little bit differently about that. But by and large, there are no nationally prescribed norms. The only nationally prescribed norm is you have to be able to practice with continuity of care across state lines. So when you take care of your patient and they are going away to school, that's not a problem because you're doing the continuity of care. But let's say the patient says, look, I'm leaving the state. I can't stand living in Louisiana anymore. I'm moving to Montana. Okay. You say, look, we'll help you till you get a doctor in Montana, but you're going to have to get an MP in the Montana. So you're going to provide transitional continuity of care and then say, we've been taking care of you for 2 weeks here. Or have you got a new doctor? Oh, well, no. Let's see what we can do to get somebody, because that's when you're going to get in trouble. I think when it goes beyond the concept of continuity of care.
So, Van, are there any issues if the Louisiana licensed provider is traveling overseas and providing telehealth to a patient who resides in Louisiana?
If the Louisiana provider is providing telehealth by internet, I don't care where from, I foresee no problem. Patricia, do you?
No, I do not. The method of communication, as long as it's HIPAA compliant and all that other good stuff,
Mhm.
if you get on SpaceX and go to the moon, you can still.
Are there
But
limitations with controlled substances in that regard?
Again, it's not the practice, it is the HIPAA compliance that's the most important. In
Okay.
other words, I can't vouch for the fact that if you did it with one of those video Apple things, Apple Talk, whatever,
Right.
that's not HIPAA compliant. Okay. I would tell you that I don't really believe that Zoom is HIPAA compliant. Okay.
Mhm.
But there are HIPAA compliant telehealth platforms that you would have to use.
Yep.
And absent that, we don't have a problem.
Van,
And
a question.
I agree with everything that Van has said. If I have a patient who is, a resident of Louisiana, but is attending school in Mississippi or Florida, a lot of times what happens is they'll come back for a vacation or a school break or something like that because they're still Louisiana residents. And I haven't had any kind of problem or any kind of concerns, and no one has threatened me with having my license lifted for sending prescriptions to a pharmacy, for a Schedule II drug like an ADHD medication, because they're still a Louisiana resident.
Mhm.
And the pharmacies aren't concerned about it either. They don't say
Mhm.
anything to me.
I think the issue came up on our listserv several months ago about if you're out of the country, the DEA may have some regulations about submitting a controlled substance back into the states, but I've never found anything to really clarify that one way or the other.
Well, the
I've gone down
DEA
all-
has been dilly-dallying with the requirement that they established pre-COVID
Mhm.
that said in order to prescribe a controlled dangerous substance, you must have had an in-person visit at
Mhm.
least once to establish that. We're talking about established patients that you happen to be visiting. Well, you're not going to, when you're on vacation, I don't assume you're going to be establishing new patients by telehealth.
Correct.
These are going to be established patients. So I don't think you violate even the earlier pre-HIPAA requirement of the DEA, which is part of our telehealth requirement. Now, what happened is when COVID hit, the DEA then suspended that requirement, as did Louisiana, during the COVID emergency. When the Louisiana COVID emergency was ended, that abeyance ended in Louisiana, but the federal government has yet to issue a final clearance of that through the DEA that they've ended it and it's going back to the old way. They have simply extended that provision Now, I think it's 3 times,
Four
and they
times.
won't
just yep.
definitively change.
They just extended it again to December of 2026.
That's correct.
Yeah, that's the fourth extension. Yeah. So because Louisiana went back to its pre-COVID and the DEA is extending, who rules?
Well, Pat is doing some serious research, and we plan on putting forth a SOP on that, not too distant future. But the problem is that we don't clearly understand where the federal government has jurisdiction in terms of, is it a federal violation of the Wire Act that because you're using federally government interstate transmission systems to go from Montana to New Orleans? We don't understand. We're doing the research on that because there's just not a lot of clear definition. And this constant extension has put everybody in a trick bag. And some states have simply stated that we're going to do whatever the DEA says. We have not done that yet. We are looking at those possibilities, but Patricia's doing the research. I mean, you might kind of comment where you are on that, Patricia.
Yeah, I mean, the closest parallel that I'm found and I'm familiar with so far is felon in possession of a firearm and getting pardoned by your state, like first offender pardons and stuff like that. Louisiana has taken the position that a first offender pardon returns all of a person's legal rights, civil rights, etc. The federal government does not believe that. The federal government believes only a gold seal governor's pardon restores firearm rights. So I'm trying to determine any other instances on the sliding scale of when can a state deviate from a federal requirement in the public health and safety arena. And I'm still working on it, coming close to having some sort of conclusion to present to the board, but not quite there yet. But that's the issue is, um, if a person is doing something that's legal under state law, but it's still a violation of federal law, they're in a trick bag for potential liability for that. And we want to be able to give the most clearest, accurate guidance for all of our practitioners. It would be so great if they would just pass a law, but no such luck.
I mean, it's a little bit like what we experienced in this whole thing about medical marijuana. Okay.
Yep.
And so it's been, now if they finally do, the DEA finally does say this is a Schedule III controlled substance, everything's copacetic. But nope, they're still evolving.
Gotcha. Another question that was raised about whether this fell under the rubric of telehealth. Some states apparently have difficulty finding examiners for disability examinations or competency and sanity evaluations. So they hire examiners from other states to conduct these. And apparently some Louisiana medical psychologists have been approached about doing this. Any problems with that?
Well, technically at that point, you are practicing medicine in that other state.
Unless they send the person to here for the examination.
Right.
That's how on the Texas border, we've had issues of that in the past. There are a lot of shops in Texas that are strictly litigation-based review, reporting type things. That's all they do. And if you're doing it records only and that kind of thing, you are practicing medicine. And if If the patient doesn't come to you for that, for the examination, even though the results are reported to the other state, that's not a violation. But if you do it remotely, you are practicing medicine in that, practicing medical psychology in that state, and that would default to the state laws at that point.
And also, I would be concerned about whether or not your professional liability covered you in that other state.
Because you're just on a basic general level, you're seeing somebody who's not a resident of this state, which is a requirement of telehealth. So what I'm understanding is probably best to avoid those situations.
Well, again,
Or get good guidance from someone who is familiar with the laws in that state and can tell that individual that they're okay. And we're not in a position to do that.
and also call your professional liability carrier, because we don't get involved in that, and say, am I covered when I do this in the other state?
Gotcha. Okay, that's good information.
So Warren, just circling back to how this discussion started about, should we put telehealth in the rules? I'm leaning from this conversation that no, we don't need to do that. That we're already covered.
Yeah.
Okay.
The only reason I raise that is, as I was trying to do some research on some of these questions that have come up, physicians do have in their statute a section on telehealth.
And we can certainly put one in in the rules for MPs. Understand that the law supersedes any rules or the absence of the rules. We can clarify the law and make it clear for you, but ultimately we can't change the law.
Yeah, as long as we can do it, I'm not seeing a real need to change the law.
And
Yeah,
look, it may come a point where there's so much disconsternation, we need to, and we'll do it. But I mean, at this point, not high on my list. It's not high on your list.
Right, because the omnibus bill, the bill that covers all providers, covers y'all too. And part of the reason for the separate one for physicians, even though that preceded the new law, is that there were some elements of the practice of medicine that of physicians, the board determined that needed to be part of the rulemaking for them. I don't know at this moment of any that are specific to you all that would not be answered or covered under the bill that covers under the law that covers all providers. If it ever came to pass that there did need to be, we could certainly insert that in your field specific rules as well.
And that is the Freddie Mills.
Yes.
Bill. Okay.
Yes.
Okay.
That governs telehealth universally.
Okay. Good deal. Does anybody have anything else I want to talk about, discuss, ask about? Anybody want to make a motion to adjourn?
I'd like to wish everybody a happy Valentine's Day and a happy Mardi Gras.
Stay warm and dry.
Oh, stay warm for sure.
And don't drive if you can avoid it.
Yeah, stay off the
Please.
road. All right.
Then I make
thanks,
a motion
everyone.
for adjournment.
Second.
Thanks, everybody. Appreciate everybody's
Thank
help.
you.
Yeah, appreciate it.
Bye-bye.
Goodbye.
God bless. Bye now.